Hello and welcome back to my channel. So let's discuss today what things to avoid 10 days before Neet-PG. So let's start. First of all, do not start anything new. I have seen n number of students just picking up some new subject 10 days before just because they think this might be important for the exam. They have not tested that topic for 6-7 months, but now suddenly they think that it might be important, so they start studying it. Never ever start anything new. Whatever you have revised, whatever you have read, just revise it again, read it again, and then do PYT and PYQ. See, because what will happen if you start anything new, you won't be remembering whatever you will be reading once, that's for sure. And in the time that you could have revised your weak subjects, and you have lost that time as well. So never ever start anything new, just revise what you have read and re-revise it. Second, do not look what others are doing. If someone is revising biochemistry on the last day, does not mean you also have to revise biochemistry. If you're strong in biochemistry and if your anatomy is weak, you should be revising anatomy or whatever your weak subject is on the last day or 2 days before exam. Just because someone else is revising something does not mean you also have to revise that. Focus on yourself, focus on your journey. What is your weak points? What is your area of improvement, and then work upon it, and do not look what others are doing. Because if you are strong in biochemistry, you need not go through it, and you might be able to solve all the questions of biochemistry without even revising it, because you have read it so many times and you are so confident. But if you are weak in suppose anatomy, and you could not remember brachial plexus, lumbar plexus, nerve roots, so you should be revising your difficult part. Okay, don't judge yourself or feel disheartened if you can't recall something. See, whenever you go to sleep at night, so whenever you'll be closing your eyes, you must be popping multiple questions or topics must be popping in your brain. See, what was the answer? What was the question? What was the clinical feature? What was the drug, dose and drug? But you might not be able to recall. And see, listen, this is completely normal. This happens with everyone, even with the toppers. Everyone goes through the same thing. But see, when the exam pops up in the question, your brain has a long-term memory area known as neocortex, where you can think and the things will be already coming into your brain from neocortex. कि कौन सा पेज नंबर था, कौन सा कॉर्नर पे लिखा था, what was the highlighter, मैंने ये लिखा था, फिर ये arrow लगाया था. So that will come automatically in the exam. But if currently you are thinking you might not be able to recall, it's completely fine. Just take a deep breath. It happens with everyone. Just get up, just go through that topic and that page and just close it up and then sleep again. Because सोचोगे नहीं हो पाएगा, नहीं होगा, मुझे याद नहीं आ रहा, तो अपने आप को ना कभी भी disheartened फील नहीं करवाना, स्पेशली इन लास्ट 10 days में कि मुझसे नहीं हो पाएगा. So just go through that topic and then sleep again. Don't give GT in last 10 days. See, you might have been preparing for quite a few months, or even 7 or 12 months, and you have given n number of GTs through your preparation, and you know from where you started and from where you came and where you have reached. So that's a good amount of questions and practice you have done through your preparation. See, GTs are just a mixed number of questions from different topics. At times it can be easy, at times it can be difficult, or at times it can be okay. Neet-PG is not very difficult or very easy. But by chance, suppose if GT ka paper was quite on a difficult side and you got less number of correct questions, or your rank fell, or the number of correct questions or number of correct answers were quite on a lower side. So you will be in a vicious cycle कि मुझसे नहीं हो पाएगा, मेरे इसमें खराब आए हैं तो मेरे नीट-PG में भी खराब आएंगे, मैं यहाँ नहीं कर पा तो मैं नीट-PG में भी नहीं कर पाऊंगा. So do not fall into the trap of underconfidence during last 10 days. Just revise, do PYT, PYQ and revise and then sleep. You don't have time to think anything bad about yourself. Do not say in the last 10 days कि मैं नहीं कर पाऊंगा, मुझसे नहीं हो पाएगा, इस साल नहीं हो रहा, I'm giving up. This is the time when others will give up and you don't have to. Just because others will give up by falling into the vicious cycle कि मैं नहीं कर पा रहा, मुझसे नहीं हो रहा, you have to just give that much amount of efforts and head start, and then you will see the results in the exam. Do not sleep late and wake up late, because see, exams are mainly early in the morning, in the before 12 p.m. But if you are someone who is more accustomed for studying late at night and then waking up late, so you have to make your body accustomed with that timing, not even just 10 days before, but almost a month or 2 months before, just because your brain knows maximally when to work. Because if you are someone who studies late at night, so your brain won't be in a habit to work maximally early in the morning, but that's where you should be having your full concentration, your full focus, and your full attention. Boka boka, that will only happen when you will be having a perfect cycle that will resonate the exam timing. So try to sleep early and wake up early, and then try to give your GTs during that time only, early in the morning when the exams are usually happening, just because your brain knows that this is the time I have to work maximally. And then don't eat from outside. See, I have seen multiple friends just before the last Neet-PG, they fell so sick just because they had some get together a month or 15 days back, or someone came to their home, they ordered food, and then they had pain abdomen, fever, gastroenteritis, bloating, and discomfort, everything, just because of their health. They could not focus on their studies. They were so much ready with their preparation, they have revised 5-6 times the whole subject, the whole course, but just because they fell lag by 10 or 12 days because of their health, so they lost all their efforts and they did not get a good rank, or they did not secure a good marks. So you have to be in the best of your physical health on the day of exam. You cannot afford to lose anything just by your mistake, because your health is in your hands. So you should be focusing upon eating healthy and keeping your mind healthy maximally on the day of exam. Ye kab hoga? When you'll be having a long-term habit of eating healthy and feeling good about yourself. Okay, I hope this video has helped you. Thank you.